ICRA stands for Infection Control Risk Assessment. It's a procedure inside of a hospital facility for identifying the risk of infection from construction projects into the patient space or into an occupied area. Each healthcare facility will have their own ICRA officer, and as well as their own procedure for determining and improving installation of the ICRA mitigation factors. These procedures tell you how you're allowed to do your work, how you're allowed to access your space, and what additional factors you need to include in your estimates and your scheduling. It's very important to take this into consideration when you are doing the planning for an area, because it's going to take a lot of extra time and setup, and sometimes you can't grab everything in a room because you need this barrier. You have to split the room in half and mobilize space. So it's very important that you consider the risk of infection when you get started. So the reason for this is this little germ here called Aspergillus. There are other ones, but other ones out there, but this is the main one. And Aspergillus is a fungi. It kind of attaches to any sort of dust particle that you have in leaves, soil, any packing materials. And the issue with it is that it'll float in the air with the dust. And small dust particles the size of one of these spores can stay in the air for 4 to 8 hours, which means that even though you're there and you're done with your work, it could still be off of you. Now, we come into the contact with this daily, but we're not in the same condition as people that are in the hospital, and they are at increased risk. So when they come encounter with it, they can actually get sick and die from this. It's another important part of planning to make sure that we prepare for this. The thing in the bottom right is a tacky mat. I'll talk about that in my next slide. So ICRA isn't just about stopping the germs. You're going into an occupied facility, and you're going to impact all the patients and everyone around you. So this form to the right is a typical ICRA evaluation form where all these type A, B, C, and D will determine the type of construction that you're doing, whether it's going to be dust producing or not, and the risk factor is associated with the area that it's in. And that will determine the level of mitigation that you need for the room. But when you take this stuff into consideration, you also have to realize that your pollution is more than just dust. You're going to have noise pollution, vibration, and you impact in 6 directions, so all around you. It's not just the floor you're on. You're going to impact above and below you. A lot of times you'll be in restricted access areas, which means that you might need additional screening that you have to prepare for before you can even go in and do your work, such as labor and delivery suites or operating suites, where you need to be certified by the hospital, and they might run a background check on all your employees before you can even go into those areas. And the level of ICRA mitigation is going to be determined by the unit. If you're in an office space, it's going to be a type A. It's going to be very low. You're not going to need to do a whole lot. But if you're in a neonatal intensive care unit, they're going to require everything, and it might be 2 Tyvek suits with a vacuum and an anteroom. So how do we mitigate our risk of infection into the space? The most common thing is to have an air quality management program using a HEPA machine. These HEPA machines can filter out particles that are up to a few micrometers in size, and so they use them to control the air quality and pull the dust out. We also use these to set up negative pressure in the space that we're working on. This means that we'll pull all the dust particles into our space rather than forcing them out by pressure, and then we can exhaust out into an unoccupied area. We can put tachymats down to absorb dust, and we can use anterooms to enter and exit our areas where we can vacuum ourselves off or have the tachymats, or just as another barrier, a double barrier. Sometimes they require you to wear Tyvek suits. That's when you're getting into the really hazardous areas. So you wear a Tyvek suit, and sometimes you can wear 2 Tyvek suits. And when you're done with your work, you take off the outside suit, throw it away, and go out on your way. And then there's also HEPA vacs to help get rid of other stuff. Now I'm going to turn it over to my associates for interim life safety.